If you're constantly waking up tired, getting headaches, and you can't seem to sleep throughout the night, it might have nothing to do with stress, your diet, or even your brain. In fact, the cause could be hiding in your mouth, and most doctors never check for it. Today, I'm going to show you how one small thing you've probably never thought about could be wrecking your sleep, it could be draining your energy, and it could be making your head pound, and what to do about it before it gets worse. I'm Dr. Ingi, a Harvard-trained orthodontist, and I've helped thousands of people understand the connection between their bite and their health. What I'm about to share with you isn't taught in medical or dental school, and most practitioners miss it completely. But the research is clear, and the impact on your life could be massive. So let me show you exactly what's happening in your mouth while you're sleeping, and why it might be the reason that you feel terrible every morning. The position of your jaw literally controls how much air flows into your lungs every single night. So I had a patient, Maria, who came in for Invisalign because she had an overbite. She mentioned being exhausted at work, even though she was sleeping 8 to 9 hours a night. So I took a 3D scan and a CBCT, and I was able to measure that her overbite was creating a 31% reduction in her airway volume. She was trying to breathe through a straw when what she really needed was a garden hose. Research shows that bite problems can reduce your airway by up to 40%. Your body fights for oxygen all night, and you wake up feeling like you ran a marathon in your sleep. If you snore, wake up with a dry mouth, or you feel exhausted after a full night's sleep, your bite could literally be creating a traffic jam in your airway. But restricted breathing is just the beginning. The second problem is happening in your jaw muscles right now. Your jaw never gets to rest if your bite is misaligned. So I want you to put your hands on your jaw and clench your teeth. Feel those muscles bulge? Now imagine those muscles never get to relax. Not during the day, not at night, not ever. Clinical studies showed that a misaligned bite can create forces that are up to 10 times the normal force on certain teeth. This constant tension travels up through your temples, across your forehead, and down your neck and shoulders like a chain reaction. And not all bite problems are created equal. These 4 are the biggest red flags, and if you got one, your jaw might be quietly stealing oxygen from you every night. Overbite with a set back lower jaw. Think your bottom jaw is hiding behind your top teeth. This shows up in about 1 in 5 people, and it shrinks the space between your tongue and your airway that's needed to breathe. Deep bite. When your top teeth completely cover your bottom teeth when you close your mouth. Roughly 15 to 20% of people have it, and it can push your jaw and your tongue back towards your throat. Crossbite. When some top teeth lie inside of your bottom teeth. This happens in 7 to 15% of people, and it can twist your jaw, mess with your muscle balance, and it can narrow your airway. Severe jaw mismatch. About 1 in 20 people have such big differences between their upper and their lower jaw position that surgery is the only fix, and airway problems are almost always part of the picture. If you've got one of these, it's worth looking beyond cosmetic fixes. The shape of your bite isn't just about how you look, it's about how you breathe. Research shows that correcting your bite alignment can reduce tension headaches by up to 70%. So if you wake up with jaw soreness, neck tension, or headaches that wrap around your head, this muscle cascade might be the culprit. Now here's the third problem that's even more destructive, and most people don't even know what's happening. You might be grinding your teeth right now and you don't even know it. Run your tongue along your front teeth. Do they feel sharp, flat, or worn down? If they feel flat, there's a good chance that you've been grinding, probably with forces equivalent to about 200 pounds per square inch every night. Research shows that every millimeter of enamel that you lose increases sensitivity to temperature by 30%. The grinding motion creates vibrations that travel to your temple, and it triggers migraines. Your teeth act like tuning forks, and it resonates pain throughout your head. Once enamel's gone, it doesn't grow back, and the sensitivity, cracks, and chips just keep coming. If you have sensitive teeth, worn down enamel, or you wake up feeling like you got punched in the face, grinding from bite issues could be silently destroying your teeth and your quality of life. But here's where this gets really scary. These 3 problems don't stay isolated in your mouth. Your bite problems don't stay in your mouth. They travel throughout your body. Once you understand these connections, you see how it creates a domino effect throughout your body. Restricted airway leads to poor sleep. Poor sleep increases inflammation markers by 261%. Higher inflammation affects your heart, your brain, and your immune system. The bacteria thriving in crowded teeth can enter your bloodstream and cross your blood-brain barrier. These same bacteria are found at 2.1 times higher concentration in Alzheimer's patients' brain tissue. This is why fixing your bite isn't cosmetic, it's preventative medicine. So if this is such a widespread health issue, why isn't anyone talking about it? The answer will make you angry. Medical school doesn't teach doctors to look in your mouth for health problems. The average medical student gets 4 hours of oral health education in 4 years. 4 hours! I had a patient who suffered from chronic fatigue and headaches who saw 4 specialists for her chronic migraines. She saw a neurologist, a cardiologist, a sleep specialist, and even a psychiatrist. She spent $8,000 out of pocket. Not one looked at whether her bite could be affecting the issue. So we expanded her upper arch and we corrected her overbite by bringing her lower jaw forward, and she was finally able to sleep throughout the night and her headaches went away. Medical school teaches compartmentalized thinking. Headaches go to neurology, sleep problems go to sleep medicine, but your mouth connects to everything. And there's no specialty that's looking at all of these connections. And because doctors miss this connection, here's what not doing anything about it actually costs you. Waiting to fix bite problems costs you way more than money. The average person spends over $40,000 in dental work over their lifetime. Most of this dental work is preventable, and it's not by brushing and flossing better. It's by having aligned teeth and a well-positioned bite. But the real cost isn't financial. How many mornings will you wake up exhausted? How many years of poor sleep will age your brain prematurely? Research shows that every year of sleep-disordered breathing ages your cardiovascular system by 18 months. I had a patient wait until he was 55 years old to address his deep bite. The total cost was $37,000 for crowns to replace his molars that had completely worn out, gum surgery, and sleep apnea treatment. If he'd addressed this at 35, it would have been $6,000 for orthodontic treatment, or about $150 a month, 6 times more expensive by waiting. Prevention always costs less than treatment. The best time to address this was 10 years ago. The second best time, right now. Okay, so you're probably wondering, do I have this problem? Here's how to find out in the next 60 seconds. Here's a simple checklist you can do right now. First, do you snore or wake up with a dry mouth? Second, do you get headaches within an hour of waking up? Third, can you fit 3 fingers vertically between your teeth? Fourth, do your teeth show wear patterns or look shorter than they used to? Fifth, do you catch yourself clenching during the day? If you check 2 or more boxes, you need a comprehensive bite evaluation, not just the cleaning. Next time you see your dentist, ask for a complimentary 3D teeth scan and have your dentist check for premature tooth wear. Look for flattened teeth, little notches at your gum line, or cracks. All are signs that your bite might be wearing down your teeth while you're sleeping. Some bite problems are invisible. You might look like you have straight teeth, but still have airway restrictions that only show up under analysis. Now, here's the good news. If you do have this problem, we're living in the absolute best time in history to fix it. Modern bite correction is completely different than the metal braces that your parents had. We're living in the golden age of bite correction. We have AI that predicts airway changes, digital scanning that's 52% more accurate than old impressions, and remote monitoring that reduces your treatment time by 27%. But not all treatment is created equal. Research shows that orthodontist supervised treatment has a 95% success rate compared to non-specialist treatments. When dealing with health issues, that success rate matters. And don't go with mail order aligners or a cheaper aligner option. We've already seen this play out. Smile Direct Club exploded in popularity for a few years because it promised straight teeth without ever stepping foot in a dentist's office. But here's what most people didn't hear about. In 2023, they filed for bankruptcy after thousands of patient complaints about pain, bite problems, and even tooth damage from unsupervised treatment. So if you care about your health and not just a quick cosmetic fix, look for a board-certified orthodontist who understands the medical implications, does a 3D airway analysis, and has experience patients treating bite-related health issues. The right provider won't just make your teeth look good, they'll make sure that your mouth, your jaw, and your airway are all functioning their best. And when you get the right treatment from the right provider, here's what actually happens to your life. Fixing your bite doesn't just straighten your teeth, it can change your entire life. Let me tell you what happens when you fix the root cause. I have a patient, Sarah, who came for crooked teeth, but was using a CPAP machine and taking migraine medication 3 times a week. 6 months into treatment, she slept throughout the night without her CPAP for the first time in 5 years. By month 8, her migraines went from daily to monthly. By month 10, she'd lost 15 pounds because she finally had energy. Her husband said that she stopped snoring completely. When you improve your airway function and your jaw alignment, your body starts working properly. Better sleep leads to better hormone regulation, and less pain means better mood. More energy creates a positive cycle. The earlier you address this, the more dramatic the results. Your body has an amazing ability to heal when you remove the source of the problem. You don't have to live with chronic pain, fatigue, and poor sleep. Every night that you delay, it's another night of poor sleep, another morning of headaches, and another day of feeling less than your best. Your best life is waiting on the other side of this decision. If you're dealing with chronic fatigue, headaches, or sleep issues, don't accept this as normal. Your bite could be the missing piece that doctors have been overlooking. Start with that checklist, and if you're checking multiple boxes, get a comprehensive bite evaluation. I've helped thousands of patients connect the dots between their mouth and their health. If you want more stories, tips, and insights from my experience, explore my other videos.